Okay, good morning, everyone. I'm just checking to make sure that you could hear me okay. Thinking my audio may have cut out before. If someone could give me a thumbs up, or if any of my colleagues in the background can let me know if you can hear me okay.
Yep, can hear you good.
Sound great.
Wonderful. Thank you, everybody. Good morning. Thanks, everyone, for joining us for the CFSS Provider Agency Office Hours. We're happy to have you here with us today. My name is Erin Haldine, and I am the CFSS Policy Lead in the Disability Services Division. And I'm joined by the Supervisor of the Home Care and Self-Directed Team, Janine Wilson. So you might hear her unmute and speak as well. Today we plan to just do a very brief CFSS overview. They're similar slides to what we did at the beginning of last time we met. 2 weeks ago. We're going to go over the survey results that you guys completed at the last meeting. We'll talk through worker training and development, as well as the service delivery plan, then review some resources and trainings that are available to you, and then we'll have a slide at the end with all our future meeting dates. So we just want to make sure that everybody is attending the right meeting. So we offer quite a few meetings each week or every other week. And there is some confusion because a lot of them are called office hours. So I just want to make sure that everybody is attending the right meeting today. Today, this is a training for CFSS provider agencies. So in other words, those are the PCA agencies that are transitioning over to be CFSS providers. Or possibly there may be some people in here who are new, a new CFSS provider agency. So we offer other meetings for FMS providers, lead agencies, consultation services, etc. But this meeting today is for the CFSS provider agencies to talk about policy related questions. So we just want to make sure you're in the right meeting. If you are a part of one of those other groups, you certainly can stay, but know that the information that we're presenting on is for the provider agencies, and the processes may vary if you're a part of a different provider type. So at the last time we met, we talked through the CFSS authorization process. I won't open up the link and click on each of the different icons. I'll let you do that on your own if you'd like. But there is a authorization process that discusses the time from when a person is assessed for CFSS and all of the different steps that they would go through until the lead agency enters in a service agreement authorizing CFSS for use. If you're not familiar, we do have CFSS forms and documents that are all published on one page. So I'm going to share that with you. This is actually a part of our CFSS policy manual. So if you're not familiar with that policy manual, of course, we encourage everybody to review the manual. And on the very last page at the bottom here, so this is our table of contents. At the very bottom under resources are the forms. And so if you click on the forms link, it will take you to all of our forms and documents. And then you can review the forms and documents that apply to you as a CFSS provider agency. Okay. So there are a number here, and we do update them. If we publish a new form, it does get updated on this page. Okay, so just to provide some clarification, because I think all of you were also invited to the provider agency office hours for enrollment. Those are happening every Thursday from 11 to 12. And you don't need to pre-register to attend those meetings. So there is a link that you should just be able to click on and join that meeting. And those meetings are to allow you time to ask questions on how to become enrolled as a CFSS provider agency, or to ask questions on what that process looks like. If you have somebody if you're a current PCA provider and you have someone that's chosen you to be their CFSS provider, and you know that you've submitted all of your enrollment documents but aren't yet coded for CFSS, so technically not enrolled to provide CFSS, please go ahead and call the MHCP Provider Resource Center at the number that's on the screen, and they can try to expedite your enrollment. We have a large volume of providers that are trying to enroll, so we're just going in order. But if you have someone who's actually chosen you and they are ready to begin CFSS services, go ahead and call that number, and then we can try to rush that enrollment if possible. Or at least we can look to see if you've submitted all of the documents to become enrolled. Okay, the last time we met, we had asked a question on what topics are you interested in learning more about at future office hours. And the winner was worker training and development. So we are going to review worker training and development today. In a close second was the service delivery plan. So we're also going to review the service delivery plan today. And then at future meetings, we can go over the other topics that maybe weren't of as much interest, but still important to learn. Okay, so first we're going to start with worker training and development. So just so everyone understands what worker training and development is, it is a separate budget that is available to you as CFSS provider agencies to pay for training, observation, monitoring, and coaching of the CFSS workers. Okay, so these activities help CFSS workers expand their skills to support the person's specific needs. Okay, so this is really similar to the QP units under PCA, if that kind of helps give you a frame of reference of what worker training and development budget is. Okay, so what is the process for worker training and development? So when a person's eligible for and chooses to receive CFSS through the agency model, okay, so we're not talking about the budget model at all in today's presentation, so just the agency model, the person includes ideas and information about their worker training needs when they're writing their service delivery plan. And when we go over the plan later in the presentation, I'll show you where that section is. So then the lead agency authorizes worker training and development for the person. The CFSS provider agency and person write and refine the worker training and development plan. The supervising professional trains the person's workers and ensures that they are competent. The worker can attend classes if that applies to them and it's in their service delivery plan. And then the CFSS provider agency bills DHS for the time supervising professional spends training the workers and for attending classes if it applies. Okay. So how much is the worker training and development budget? So on January 1st, the worker training and development budget increased to $1,328.64. Okay. And the lead agency is always going to authorize this full amount to you as the provider agency. So different than how QP units have used in the past for PCA, if you run out of funds, you can always request additional money. Okay, so if the person hires a lot of new workers or the workers require more training and that $1,328 is not enough, you can request additional funds. And you would request that by submitting the DHS 6893K, which is the technical change request form. So what can the CFSS provider agency use the worker training and development funds for? So the CFSS provider agency can use the funds to pay the supervising professional to explain and demonstrate the needed tasks to the workers, observe, monitor, and coach the worker on performing those tasks, evaluate the worker's competency in performing the tasks, and to document that the worker is competent to perform the tasks. So essentially, you can use this budget to train the workers to work with the individual and provide that evaluation as needed. So can the worker training and development budget be used for classes? Yes, it can. So in addition to what I just showed on the previous slide, it can also be used to send a worker to a class. So the worker training and development budget can be used to pay the fees for a worker to attend a class on topics related to the person's assessed needs. So one thing that we did want to make clear though, is the worker training and development budget cannot pay for the worker's wages to attend the class. Okay, so the CFSS provider agency will pay for the worker's time spent in training through their overhead costs. So what worker training and development tasks can the CFSS provider agency bill for? They can bill for the time spent time the supervising professional spent training the workers, the time spent fulfilling service evaluations and supervision responsibilities for classes attended by the worker, if that applies. And then again, just another reminder that the provider agency cannot bill for the worker training and development budget for the worker's time spent receiving the training. Okay, again, that is just part of the overhead costs of being a provider agency. Okay, so if a worker attends the class itself can be paid for, but the worker's time is not billed to that line. So does the CFSS provider agency need to retrain the workers when transitioning from PCA to CFSS? So yes, you do. The reason for this is CFSS is a new service. So keep that in mind as people are transitioning over this next year from receiving PCA services, possibly through you as their PCA provider. And as that person transitions to CFSS, whether they are new to you as an agency or they've been receiving services from you for many years, say as a PCA, they do need to be retrained and to follow all those, all the policies that we have in place for a new worker because it is a new service. So, can the CFSS provider agency request additional worker training and development funds if needed? So yes, you can. And that's where you're going to want to submit the 6893K to request additional funds. Okay, so I'm going to pause there because that's the end of the worker training and development section of this presentation. Next, we're going to go through the service delivery plan. And I just want to see if there are any questions in the chat regarding this topic.
So Erin, there were a couple of questions about if two agencies are involved, do they both get the full worker training and development budget? And that is a yes. So that was answered in the chat. I think there's a question that probably we can address when we're talking through this service delivery plan about how people are choosing an agency. It may be that they're not having that, the person is not having a conversation with the agency and just choosing them. So we can talk about that a little bit. Let me see. So the QPs need to retrain PCA workers when the client transitions. Yes, but of course you know the workers and you know what they know, and so really it is just simply retraining to be sure that you can document that for CFSS. There's a question that I need to look at a little bit closer, but just to say that this worker training and development is no longer 15-minute units. It is just a lump sum dollar amount. And so I think a lot of agencies are just thinking about how they build for QP time and CF in PCA rather. The amount you get in your lump sum budget is basically the QP rate times 96 units. and you don't report a certain number of minutes or units when you're billing it.
Maybe what we can do for our next presentation, I am reading that question you're reviewing, Janine, about the billing for worker training and development. I want to connect with our billing staff here to see how that is billed, and then we can provide a slide or a couple slides giving you guys more information on how to bill for that worker training and development budget, because I see this a couple of times regarding the 15-minute units and instead of a lump sum. So let us get back to you on that piece.
Yep. Just so for people to know that CMS didn't necessarily create a bunch of codes that work for CFSS and self-directed services. So the code that we have for worker training and development is really a lump sum kind of per diem code. So there's no time associated with it, which is a challenge when you're used to doing 15-minute increments. So for all of CFSS, some of how we had to set it up was driven by the code that we could get approved. So, but we'll come back and talk more about billing, certainly.
Okay, I think we'll go ahead and take a look at the service delivery plan. I see some questions in the chat regarding the plan. So let me just open up what this plan looks like. And I am not going to fill out a sample plan because that would be that would probably take more time than we have. But what I am going to do is just review this kind of line by line with everybody and then answer some basic questions afterward. So this is what the service delivery plan looks like. The most current version, if you look up to the right hand side of the page, it has a 1-25. That means January of 2025. This is the most current version that we have. We made some edits in January and republished this document. So if someone was starting to work on their service delivery plan prior to January, they may have an outdated version, but know that ones coming in should now have this January date up here. So the consultation services provider and the person are working together to develop the person's service delivery plan. Okay, so that is something that's occurring before they get to you as the CFSS provider agency. So the person can write their plan independently and just submit it to their consultation services provider to review and then submit to the lead agency for approval. Or a person can work with their consultation services provider to develop the plan. So it's really up to the person what they'd like to do. We've heard from both people doing both options, some people using their consultation provider and some developing the plan on their own. So either way is fine. It's really up to the person how much they want to use their consultation services provider to help in plan development. Okay, so for a lot of the plans that are coming to you now, they're likely going to be a new plan. There is an option to select revised if they're going to change their plan throughout the year. But for today's example, we'll just go through what a new plan looks like. And then the dates of the plan. So let's just say January 1st to the end of December to follow a calendar year in this example. Okay. So this information, of course, it's written for the person. So this is going to be all the person's identifying information. And then a question about if they direct their own care. So do they have a participant representative or are they their own representative? So let's use the example of, they do direct your own care? No. And then they would list the person's representative here. Now, this is important to look at because as you all know, the person's representative cannot be a worker under CFSS. Okay, so you'll want to make sure that if they have, probably the most common scenario we run into is the question of if a parent can be both the participant representative and the worker, and they cannot. So if the parent wants to be a worker, they cannot have their name listed here as the participant rep. They do need to select a different representative if they want to be a paid worker. Okay. Here, if the person needs an interpreter, what language do they need? And then there's this section that's about you, so about the person receiving services, and the consultation services provider and the person should try to write as much detail as possible. Some of this comes from their Min Choices assessment, but they're going to document their strengths and preferences, their goals and outcomes, and then anything that they would like you as a provider to know. There's not a requirement of what needs to be listed in here, but all of these boxes do need to be completed. Okay, so then is your service plan for a full year? Yes or no? Total number of units they're eligible for. Now that is coming out of Min Choices. So the consultation services provider is going to document the number of units. And there is a note here, and we'll probably review this several times today, but the lead agency might have to adjust those eligible units based on the date the plan is approved. Okay, so if the plan gets approved a week or 2 weeks after this plan is written, they'll need to adjust the dates to reflect they'll need to adjust the units to reflect the plan approval date. Okay, so those are prorated based on the date the plan is approved. So is the person eligible for the enhanced rate? Yes or no? Yes. Okay, consultation services provider. So this is going to be their identifying information. And then is the person over 65? Are they on one of these waivers? And then the next question, which model is the person choosing? So we're not going to review the budget model because that is done through the financial management service provider or an FMS. But the plans you'll be receiving as the agency provider are the plans where the person has chosen the agency model. Okay. So you'll want to make sure that your information is listed here as the agency model provider. And then is the person planning on using a personal emergency response system or PERS? They would select yes or no. If they select yes, this additional box shows up where they're going to be listing the cost of the equipment, the cost of the installation, or the cost of the monthly subscription. And so, of course, it could be all three. And then the PERS provider is going to be billing for these on their own service agreement or their own service agreement line. So you are not billing for the PERS services as the agency provider. Okay, but it is listed in the person's plan. Okay, then the next question is if the person is planning on purchasing any goods or services. So if they select yes, this additional information will appear. And if you're not aware, if the person is selecting to purchase goods and services, that is run through the financial management service provider or an FMS. Okay, so you will not be paying or billing for any goods and services. The person can receive personal care through you as the agency provider, and their goods and services are going to be managed through the FMS provider. Okay, so they're going to list their FMS provider information here, and then any of the goods and services that they choose to purchase. Okay, and they may have many, so if they have more than one good, they're just going to be adding the separate lines onto this document. Okay, now we're going to get into the personal care part. So there's just a general schedule. Do you plan to use approximately the same amount of units each month? The answer could be yes or no. If the person selects, I thought that something else populated here. I could be wrong. Okay, I apologize. So just select yes or no. The consultation service provider, the person's going to select yes or no. And then tell the agency what preferences you have about your worker. So the person can, basically list whatever they want, maybe what they're looking for in a worker, or the type of worker that they would like to have work with them. And then this is the section that you're going to complete as the agency provider. So the consultation service provider is going to leave this box blank. And it says here, you and your agency should complete this section together. And this is the worker training and development plan. So you're going to, after the person has started services with you, or you've done that initial intake meeting with the person, you're going to talk with them about what you want their worker training and development plan to look like. So what is important to them? What do they want their workers to know about them, and how to provide services to them as an individual? Okay, so please write as much detail as possible into this section. Okay, the next section is regarding activities of daily living. So again, the consultation services provider will work with the individual on this section. A lot of this information will come out of the MnChoices assessment. And then the same with the instrumental activities of daily living, or the IADLs. Okay, and then the question, do you require observation and redirection of behaviors? So if the person selects yes, there's going to be additional boxes that will describe whatever redirection the person may need, and then what they need from their workers to assist them. Health-related procedures and tasks. Do you require support for health-related procedures and tasks? So again, if they select yes, additional boxes will appear. Similar information. What do they need their workers to do? They do require support to take self-administered medications. So yes or no. If yes, then there's additional boxes that need to be completed by the person. And that will help you as a provider agency train your workers appropriately. Okay. Again, now we're down to skill maintenance and enhancement. If they select yes, there's an additional box to describe that plan. Okay. Now for this section, if they plan to send their worker to a class, they can list the specific name of the class here, who the trainer is, and then the cost of that class. If the person has not elected to have their workers attend a class, you will still receive this $1,328.64 in the worker training and development line, because you're going to be using that for when the supervising professional trains the workers and provides that evaluation to the workers. Okay. Again, know that if you use all of those funds, you can request additional funds. So if you use all of that and then later in the year, the person decides they want to send their worker to a class, just go ahead and request those additional funds. Okay. This next section is regarding backup and emergency plans. So what will happen if the worker doesn't show up for work? Medical emergencies. What are the signs that they're having a medical emergencies? Special considerations to know regarding a medical emergency. Who are their medical providers? Again, this is optional, so the person may choose to leave this blank, and that is okay. They're not required to fill that in. How to respond to a medical emergency, and then how to respond to non-medical emergencies. Okay. Now, the consultation services providers have received training on how to complete this page with the person, but you'll want to make sure that you look through it too as a provider agency to make sure that your workers are aware of these emergencies that could occur. Then the next section is regarding the Individual Abuse Prevention Plan, or the IAPP. And this is a section that you're going to complete with the individual. So you can see here, it says complete this section with your provider agency. So that's you as the CFSS provider agency. So again, when you're doing that intake meeting or initial meeting with a person, you're going to want to be asking these questions and filling in as much detail as possible. So are there any ways you're vulnerable to abuse by others? Are you at risk of abusing others? What are some ways you and others can keep you safe from abuse? And what will you do if you experience abuse? Okay, so make sure you're filling that in with as much detail as possible. And then the service delivery plan should be coming to you with these signatures already. So there'll be a signature from the person, the person's representative or legal representative if they have one, the consultation services provider, and the lead agency. Okay, so in thinking back of what we just talked about, the CFSS provider agency, you're responsible for filling out the individual abuse prevention plan, as well as the worker training and development plan. You do not need to resubmit it to the lead agency for review or for a second signature. That this will come to you complete, and then you'll be filling in those two sections. You don't need to resubmit that to the lead agency for approval. Okay. And then the last page here is just a summary of the services that the person has chosen. So it will list the total dollar amount. This is the billing code that's over here, the item name and the billing code, the total dollar amount. Okay. Everybody's going to have consultation services on their service agreement. Everybody's going to have the worker training and development on their service agreement. You, as the provider agency, are going to be billing for this T1019 U9 line because that's the personal care. Goods and services is going to be through the FMS provider. PERS is going to be through the PERS provider. Okay, so this will really be your line as the CFSS provider agency, and then as well as the worker training and development line. Okay, and then the last is just some information in other languages. If needed for the person, they can request to receive this in another language. Okay, so I'm going to pause there for a second. I do have some more slides regarding the plan, but I just wanted to pause and see if there was anything that I should go back and review on the service delivery plan itself.
So Erin, there's one general comment, and I think we can say this to everybody. So our document, our service delivery plan document is made within the technology that we have. And so there are some pieces about Adobe that end up locking things. And so it sometimes is uneditable, going from consultation to the lead agency and coming to you, I hear. So if there's not a way for you to edit the pieces that you need to do from a PC or a CFSS agency standpoint, you can add additional pages to it, with all the identifiers and whatever. We are working on trying to figure something out, but sometimes people's computers have various whatevers on them, so it ends up locking it up or whatever. So it has been a challenge. I think, Erin, can you help me remember? Did CJ say try to print to PDF, and sometimes that opens it up?
Yeah, you can do that. I mean, it's really limited on what version of Adobe each person has, and that's what makes it difficult is often, we at DHS may have a version of Adobe that differs from you as a provider or differs from the person, what they might have on their home computer. So it does make it difficult. We are trying to come up with a different platform to use. So we'll have the Adobe version, and then we're trying to come up with a different platform, although that might take us a while to do that. And so some solutions that we've thought of are trying to print to a PDF, if that helps. We know some people might have like if you're familiar with DocuSign or other ways that a person could sign a document. If you have an editable version of Adobe where you can edit a PDF, we know that some people have that type of a version, or some providers have that. Otherwise, printing and I guess handwriting.
Yeah. I mean, I think what you could do is print like that section or that page from our online plan and just add that section in for that one on that one page. We know it's tough, and so we're trying to be as flexible as possible in getting that done. So it's not an unusual happening. We're hearing a lot about it, and that's why, like Erin mentioned, we really want to try to find a different platform that would be workable, as well as workable on a tablet or a phone, because right now these don't work that way. So it's something we're working on.
I do see a couple questions in here. Maybe what I can do is just finish this quick section on the service delivery plan that might answer some of the questions that are already in the chat, and then we can come back to this.
Yep.
One question, though, that I do want to make sure that I clarify in case you're not familiar with what a lead agency is. So the lead agency is the county, the managed care organization, or the tribal nation. So that is the person or the entity that needs to approve the service delivery plan. Okay, so we call that a lead agency, but when we say lead agency, what we're referring to is either the county, so sometimes that's a case manager, possibly. So the county, the MCO, or tribal nation. Okay, so to go back to the PowerPoint, what sections of the service delivery plan is the provider agency responsible for completing? So you're responsible for completing the individual abuse prevention plan and the worker training and development plan. All the remaining sections should come to you complete. So the person and the consultation services provider are completing those sections together. The consultation services providers have been trained on how to complete all those other sections, but they should be leaving the IAPP and the worker training and development plan blank for you to complete with the person. If they come to you and those sections have been completed, just make sure that you're meeting with the individual to make sure that that information is correct. See if they want to add information to it. If you need to add something to it as a provider agency, please go ahead and do so. Okay. Does the CFSS provider agency need to resubmit the service delivery plan to the lead agency for approval or signatures after they complete the IAPP and worker training and development sections? So no, you do not. Once the plan comes to you, it's approved by the lead agency. You do not need to resubmit to them for signatures after you've completed those sections. How often must a person create or update their service delivery plan? So they always want to complete it before starting services. They want to complete it if there is a change to their plan. And then annually at the time of reassessment. Okay, so you may not have experienced this yet since CFSS just recently began, but throughout the year, a person can revise their service delivery plan, and they might be adding goods or services, or they might be adding PERS. And so what that means is that the funds to cover those goods and services or PERS are going to come from the personal care line. And so they'll be revising their service delivery plan to add those additional items, or vice versa. Maybe the person originally planned to have goods or services and PERS, and then midway through the year, they decided they didn't need those items anymore. And so they want to move money back into the personal care line. So you'll just want to make sure that you're watching for revised service delivery plans throughout the year, as well as a revised service agreement that will reflect the new number of units that are available to you. So who sends the CFSS provider agency a copy of the 6893P, that's the service agreement, if it is updated mid-year? So that's the lead agency's responsibility. So the person and the consultation services provider will revise the plan. They'll submit it to the lead agency for approval. And then once those changes are approved, the lead agency will send you a revised copy of the plan, as well as enter in a new service agreement. So you'll, or I should say, they'll revise the current service agreement. So you'll receive a copy of that revised service agreement as well. Okay, so the units can adjust on the personal care line throughout the year, depending on if the person adds or removes other items to their plan. Okay, so those are all the slides I have regarding the 6893P. So I'm just going to go ahead and take a look at the chat. And if Janine, if you've seen questions already that you want to answer regarding the plan, go ahead.
Sure. There's one that was earlier. I think it was about straight MA going to MCO, and CFSS doesn't have any change to the workflow of who is MCO and who is not. There's nothing that we have changed. I think kind of by the end, there's a lot of questions about supervision. So there's a question about using training and development money to defray costs paid under a discount package with a university where, because of the discount package, employees can take unlimited continuing education under home health and PCA. So the thing that we need to really stress about worker training and development from a provider agency is that it really needs to be about the person's individual cares. It can't be generalized orientation to your company or anything like that. It really is specific to the person they're going to be providing services to. So that's an important piece. And anything that you purchase classes for staff needs to be really individual for the person they'll be serving.
I see kind of a similar question or a similar topic of, does DHS have any mandatory training classes? Or is it just what the person wants in their plan? So as you probably all know, there is some training that needs to be completed for a person to become a worker. That is not the type of training that we're talking about that gets written into the service delivery plan. So what's written into the plan are classes that are specific to the individual, like Janine was just saying, and DHS does not mandate what those specific classes are for an individual. So it's whatever that person needs and decides that they want to send their worker to. And that's different than the training that's needed for an individual or a person to become a worker.
Yep. Okay. Yep. So if a person has a change in condition that requires a 45-day temporary increase, that request would go to the lead agency. If the person's on a waiver, you would talk to the case manager. But for someone who's not a waiver, you would request that through the lead agency. MCOs, tribal nations, counties. There's a question about EVV, and I think we'll have to get back to you on that. I don't know a lot of detail, so I'll have to look at that separately with the EVV group on my team.
I'm seeing a question about if the person has a change in condition and that requires a 45-day increase. I think what the person, and correct me if I'm wrong, but I think the person's asking if they need to revise the service delivery plan if the person has a change in condition that requires a 45-day increase. And no, you do not need to, the service delivery plan will not be revised to reflect that. Instead, there'll be an additional line added onto the service agreement that reflects that 45-day increase.
So there's a question about if the consultation services fills in IAPP section, you would just add on your information to it. They, there may have been something that came up that they decided they would add, or if like somebody's thinking about a budget model and then changes their mind, there might be stuff in there from their work with consultation. There's an earlier one. Can the service delivery plan and CFSS auth date start before the date of the consult with consultation services provider? So there may be a service agreement that begins before that, because they may be, people may be authorized for CSG or PCA. But then the actual outside of consultation, the actual service package for CFSS would begin after the service delivery plan is approved by the lead agency. Do you see anything more, Erin, or
No, I do
people
see
on the
questions.
panel?
I do see questions regarding like supervision and evaluation, or what are the qualifications of the supervising professional. I think we'll save those questions until next week, and then we'll be able to provide slides so everyone can learn that information rather than
I like it.
just answering them verbally today. We'll put together
Right.
a couple of slides with those questions. Okay, so we do see those questions in the chat, so thank you.
Yeah, and I put in a bunch of a few links to things. So remember, we have a pretty extensive CFSS policy manual, and it goes through a lot of CFSS stuff. Right now we have pages that are PCA/CFSS, and they say the differences between the two programs. And so you should be able to look under the provider agencies area and find a lot of detail about some of the things that you've asked as well. So the annual assessment in CFSS, that still happens the way it happens now. You would be the entity that's sending a request for a reassessment 60 days ahead of the end of the service agreement.
Okay, I think we are caught up with questions. So I just wanted to review some different resources that are available to you. So the policy manual, actually, I'm going to click on the policy manual to show you the page Janine was just referring to. So this is the main page of our policy manual. If you don't have it saved, I recommend doing that. To get there, you can just Google CFSS policy manual and it should come up. But this is the home page. So we have this on the left-hand side of the screen. You can see that I'm hovering over where it says provider agencies. So if we click on provider agencies, it gives a pretty lengthy overview of what's the provider agency responsibilities. But then you can see here that it opens up many other pages. So we recommend reviewing at least this section, if not the whole policy manual, but reviewing policies and procedures, training, supervision and evaluation, owned or controlled housing, marketing, wages and benefits. Okay, so this is all information that you're responsible to know as the CFSS provider agency. Okay, and then there's a lot of other really good information in here as well. Information regarding personal care workers, information regarding the agency model versus budget model, goods, PERS, okay, person's rights and responsibilities. Okay, if you have questions on consultation or the service delivery plan. Okay, so really make sure that you're going and looking at this policy manual if you have questions. It's pretty in-depth, and will answer a lot of the questions that we're seeing in the chat here today. Okay, so that's a great resource. Some other resources are these service agreement calculators. If for some reason you wanted to know the amount of money that would change if someone wants to add a good or a service, you can do that. I don't think you'll need them too much as provider agencies, but that is available for you. Frequently asked questions. I'm just going to pull up this webpage for you. And this is probably, if you click here for the lead agency FAQ, this is probably the most useful information for you. But we have it separated into different categories of questions. And so we have transition from PCA and CSG, specific information regarding the grant, 45-day temporary start. So these are all different questions that have been asked that we've answered so far. So for example, if this is the question you have, you can just go ahead and click on that little plus sign and it will provide you the answer right below. Okay, so there's lots of different sections: eligibility and assessment, min choices, a lot of questions about consultation service providers, goods and services, PERS, service delivery plan, which some we reviewed today, waiver, okay, so workers, so lots of different categories you can go ahead and review on your own. And then if you're not signed up for our e-list announcements, we recommend that you go ahead and do that. That's our most efficient way to communicate with you. Okay, we have 3 more meetings scheduled. So they're every other Tuesday from 11 to 12. And the next meeting will be on February 25th, March 11th, and March 25th. And hopefully you've received a link to register. It was dropped in your minute inbox. And I'm assuming since you're here, you've all received that registration link. We will likely extend these office hours into April or beyond. But this is what we have scheduled so far. So these next 3 meetings. Okay. And then we'll just continue to review various topics at each of these meetings. If you have a question, a real specific question that needs to get answered, please go ahead and email us at dhs.cfss@state.mn.us. And we just ask a couple different things. So first, when you're sending us an email, please identify yourself as a CFSS provider agency. We just get a lot of emails that come to us every day from different provider types. So we want to make sure that we're answering your question correctly. And then if you can just review the CFSS policy manual or the e-list announcements to see if we've answered that question or if the question is in our, or the answer is in our policy manual, we'd really appreciate that. Okay. And with that, that is all we have for today. So we appreciate your attendance and we'll look forward to seeing you again in 2 weeks. Thanks, everybody.
Thank you.